Hello, I'm Anjula Mehta. I'm a GP and I'm the Group Medical Director for Primary Care, Community and Therapies Group. I'm delighted to speak to you about the virtual ward concept at Swansea Bay University Health Board. You may have heard of the virtual ward concept across the UK, as there are many virtual wards popping up over the last 5 years. What we hope to achieve here at Swansea Bay University Health Board is the rollout of 4 cluster virtual wards, which will all run in parallel but will have separate multidisciplinary teams to target the specific health and social care needs of the cluster population they serve. The whole idea is that we create a virtual platform to identify the most vulnerable, frail patients and in essence catch them before they become unwell or require hospital admission. This is about wraparound care closer to home where our patients really want to be. The aim is to provide holistic, patient-centred, high-quality care through rapid assessment, whole multidisciplinary team involvement and effective collaborative working between primary care, secondary care, social care and our third sector colleagues. This will hopefully achieve a reduction of avoidable hospital admission and facilitate earlier, safe discharges of patients from the acute sector. As you can imagine, to achieve this, we really need a dedicated, motivated, enthusiastic, multi-professional team to work in our virtual wards. The virtual wards will consist of project managers, clinical ward managers, social worker, clinical pharmacist, occupational therapists, clinical nurse specialists for chronic conditions management, healthcare support workers, medical sessions from consultant care of the elderly consultants, specialist palliative care consultants and GPs, and all our wider community teams. We are very excited to deliver this programme within Swansea Bay University Health Board and really hope that you consider joining us on our journey to improve patient care closer to home for our patients.